Good morning, everyone. Today, we will talk about healing. So, sa mga nakasubaybay sa ating YouTube channel and also in our Facebook page, you know na 2 weeks ago, I underwent surgery. So, it's a rhinoplasty surgery and also blepharoplasty surgery. Usually, sinasabi downtime would be 1 month to 2 months. Kasi nga, yung healing, yung pamamaga is very obvious. However, I realized na when you are actually doing healthy lifestyle and yung katawan ninyo is metabolically healthy, yung healing na yon, that's very subjective. That 1 to 2 months healing, usually, applicable lang yon sa mga taong merong average way of intake, average way of eating foods. And that average way of eating is usually high carb, very inflammatory. So ngayon, we will show you, although nakita nyo na ako many times before, maraming salamat po. Thank you very much for always being here. Kapag nagla-live tayo, I am so happy whenever I see all of you. So, we will show you again that this one is the outcome after 2 weeks of surgery. So, yung healing natin after 2 weeks. And I will tell you what I did. For you, for many of you, sa mga members ng ating masterclass, sa ating members and moderators and admins, thank you all so much ng ating Life Without Rice and LCFF. And of course, yung ating admins na nagsusupport sa ating LCF Masterclass. Thank you always for being there and making our community strong. So for those of you, I'm sure alam nyo na what's the secret with faster healing after surgery. Pero in case merong mga bago pa lang sa ating channel na hindi pa tayo kilala and ngayon pa lang sila nakakita ng ating live video, or maybe for the ones that are watching for the sake of rhinoplasty and not really on nutrition. So welcome po at maraming salamat. And the secret actually in faster healing ay nasa pagkain lamang. And we are here in the buffet area, breakfast area in the hotel. Hindi ako nag-dinner last night, so that's why I decided to have breakfast, especially that it's free. So, pakita natin ang ating post-rhinoplasty. So, yan. So, parang ako pa rin ba? So, I think it's still the same me. It's just that merong improvements. I think it is safe to say that there's some improvement. So, sa ating nose, okay na siya. And then, yung ating healing, kung titingnan nyo, yung marks is hindi talaga siya ganun ka-obvious. So, halos walang masyadong marks. And for our eyes, meron din tayong blepharoplasty. So, blepharoplasty, nakikita nyo ba parate yung eyes ko before is medyo mataba dito. Because yon, it's really genetics. Kasi my mom, half Chinese si mami. So, in Asians, especially Chinese, parang natural talaga na puffy yung eyelids. So, yun. So, yun yung ating improvements. And yet, it is still a little swollen. May pamamaga pa rin. Hopefully, sabi nila, liliit pa siya. But at least the marks, never ako nagkaroon ng bleeding, never akong nagkaroon ng crusting, yung sobrang nagka-crust. Walang ganong effect, and it's all good. Medyo hirap pang mag-smile ng full, so kasi medyo may hila pa dito. But at least somewhat, it is quite improving. Oo, naiba na ang mukha ko, no? Masanay na kayo kasi ito na yung final na mukha natin. Okay? And then, so, I will show you what I eat, kung ano yung food natin. So, of course, you always start with black coffee. So, this is Vietnamese coffee. And we also have water. So, just water lang and some ice here kasi naubusan sila ng baso. Our usual staple ko would be eggs. Although, ngayon, hindi ko siya kakainin kasi marami namang ibang pagkain. But I just show you. Kumuha lang ako for you to show you. And here in Vietnam, yung eggs nila, never ako nakita ng white egg. It's all brown eggs here. Hindi pa siguro nila na-discover yung ano yon, yung nag-delay lang, yung nagle-layering eggs na itlog lang ng itlog. And although that is not natural, and hopefully hindi nila yon ma-discover so that they will stay with organic, with free-range eggs. Hopefully, that's it. Kasi parang totoo talaga tong free range, oh, kasi may mga dumi pa. May mga dumi pa. Yung pisngi, hindi ko yun pinabawasan. So, sabi kasi, uh, kung yung pisngi ko, mataba talaga yan. Meron ding buccal fat reduction kasi natural yan. Pero yung problem, because marami kaming pasyente na when they age, kapag tumanda sila, sobra sila nagkaka ano na lumiliit masyado. So they will actually have skeletal beauty. So tinanggap ko na. So, yun yung advice sa akin ng surgeon ko, Dr. Edward Yap. Sabi niya, as a friend, hindi niya i-recommend ng magpa-buccal fat reduction ako. Kasi although temporarily it will look good while I'm young, while bata pa ako, it will look good na medyo maliit yung mukha. Pero as I age, it will look more advanced. Parang mas magiging matanda ako earlier, or when I age, matanda talaga ako tingnan. But para sa mga pareho kong gifted sa pisngi, that's actually quite a good news kasi kahit pa pumayat kayo, when you really lose weight and maybe you will trim down more, you will see na hindi kayo mangangayaya tingnan. Because for those na hindi malaki yung pisngi, konting weight loss lang, sobrang shrink na agad. So that's why, kung titingnan nyo, yung mukha ko, malaki talaga compared to my general physique. So, mas malaki yung mukha ko compared sa aking katawan. Yung parang lollipop, yun yung sabi ko kay Mami, Ming, bakit parang lollipop yung mukha ko? Parang eto ako and then malaki yung ulo ko. I always feel that parang hindi talaga siya maganda. Pero alam mo, si Maming, sobrang amazing niyang magpa-feel good about yourself. Na sabi niya, hindi, gusto ko yan. Gusto ko yan, Gracie. Gusto ko yan. Kasi malayo pa lang, if you are in the crowd, kitang-kita na kita agad. So, yun yung kanyang pampaluwag loob sa akin. Yun daw yung gusto niya. Kasi malayo pa lang, kita na niya ako. Hindi siya mahihirapang hanapin ako. So, yes, I can do buccal fat reduction. Pwede ko siyang patanggal yung taba dito para lumiit. But I decided not to because yun nga, it's a long-term effect. Kasi kapag nawala na yan, hindi na yan maibabalik. We have a lot of patients regretting. Nag-regret sila na pinakuha nila yung kanilang buccal fats because when they had their buccal fat removed, later on, when they age, because eventually as we age, mag-lose talaga, magma-muscle loss, maliliit talaga yung mukha, it's a given. And that's the time na gusto nila magpa-bulk. So they put on fillers, nagpapabanat just to have that natural lift tingnan. So yon. So oo, malapad at mataba tingnan. Kaya nga, ano to, blessing in disguise. Kasi kung maliit yung mukha ko at parati ako nag-a-advise na mag-fasting, matatakot kayo. Matatakot kayo kasi parang yung mukha natin parang skeletal beauty na. Pero nakita ninyo na kahit nagpa-fasting ako, ay, hindi naman siya lumiliit ng bonggang-bongga. Parang buhay pa rin naman. So yeah, that's blessing in disguise. So, moving on to our topic, faster healing after surgery. Immediately after surgery, actually, nag-fasting ako. I stayed fasting for almost 42 hours ba yun? Almost 2 days before surgery, and I extended it the next day ng surgery. So, halos 2 days ako nag-fasting. I think that really helped. And then, contrary to common na advice na iwasan mo na yung mga karne, iwasan mo na yung taba, iwasan mo na yung mga meat, iwasan yung itlog. No, I chose to eat meat. I chose to eat eggs. I chose to eat fish. And kahit baboy, beef, karne, I chose to eat that and I saw that I was really healing well. So for 1 week, I did that one mostly on the safe list. On the second week nga lang, I think kaya ito medyo magapa ng konti even if the healing is already good. Like as compared to my patients before, the ones I manage, this is the fastest healing na nakita ko ever. And there's no surgical marks. Hindi mo talaga makikita. Kahit pa tingnan mo ng bonggang-bongga yan, meron ng konting blister. So, kahit pa close up, hindi mo talaga yung kita. Kahit titingnan mo, parang wala talagang surgical marks. That's the most amazing part. Like, objectively speaking, ito yung kind of healing na nakita ko na very, very maganda yung healing. Hindi lang yung bias kasi skin ko to. No. And I know also na if ever I was not traveling, kasi ngayon I'm traveling, and nakita nyo na, food is somewhat hindi ganon ka marami yung options. And as we enjoy also our vacation, nakakain talaga tayo ng the ones in the caution list. Pero I know na if I stayed on the safe list, I'm sure the healing could have been a lot better. So yes, as always, natural beauty is a gift from God. Agree po ako dyan. And that's why we take care of our natural beauty by even enhancing it. And the fact that we are able to do surgery and enhance it, that talent, that gift is also coming from God, allowing us to know more and improve more. And we are not playing gods. We are just merely improving what is already given. So, fungus acne gamot para mawala. Meron lang yung sulfur soap. Sulfur soap is actually quite effective kapag merong fungus. Ako naman, isiningit pa, naka-answer to. Kasi kapag may nakita akong question, I cannot help. Sumasagot talaga ako. So, kahit pa out of topic. So, anyway, since na-answer na natin yan, yung about fungus, yung generic lang sa Philippines, I think it's from Cebu, yung main plant niyan, yung sulfur soap. That is actually quite effective. How to make it effective is that when you put it, i-leave muna, wag muna hugasan agad. So, maglagay ng sulfur soap and then let it dry for 30 minutes siguro or 1 hour. Ilagay lang muna bago ito banlawan. So, wag agad-agad banlawan. So, repeat that twice a day, maybe 2 weeks until mawala. But after, you have to moisturize kasi nagda-dry up. So, my doctor, meron tayong playlist dyan in YouTube that we mentioned. It's Dr. Edward Yap. He is our founder in facial aesthetics plastic core of ENT surgeons, where I am also a fellow in training. So si Dr. Edward Yapo yung aking doctor. You can search on him sa Google para makita ninyo. Okay, so yan. I have 4 mentors. We have Dr. Nato Pascual. Makita nyo dun siya sa Instagram and sa TikTok. Dr. Levi Lansangan of Shemian, and also Dr. J. Galvez of Galvez Clinic, and yes, Dr. Edward Yap also. Dr. Edward Yap and Dr. Nato Pascual are the main surgeons in Bello Medical Group. So yon. So that's our healing. So aside from coffee, water, and eggs, we also have meat. So this one, mostly mga processed meats kasi this is breakfast buffet, di ba? So yun, mga sausage, pero yung makita mo dito, yung kanilang fermented, this one is fermented sausage. So fermented sausage is actually quite healthier than usual. At yung ham nila, ito yung sinasabi kong ham. Kung kakain man kayo ng ham, wag yung ham na puro pink lang, okay? Yung makikita nyo talaga, yung meat and fat strands, because those are real meat. And this is my staple during my healing. Okay? Pork and beef. Kaya lang walang beef ngayon dito. It's just pork. And patapos na yung breakfast buffet. Parang konti na lang yung nandito. And those are my food. And for my condiments, wala tayong soy sauce. We just use fish sauce. Fukok Island. This is where I am now. Famous sila for pepper, black pepper, white pepper, red pepper, ano pa ba? Merong fresh pepper. Nakatikim ako ng fresh pepper the other day. So, and also patis. So, fish sauce. So, this is fish sauce with sili. Kasi mahilig tayo sa maanghang. So, that is fish sauce with sili. And we have salt. So, usually, naglalagay talaga ako ng salt. Salt and pepper. Ginaganyan ko lang, and also chili. So chili, this is chili, and we have lime. So yun lang yun actually. So pabalik-balik lang yung ating pagkain, because in low carb, we don't need to eat a lot of carbs. We don't need carbs at all. So marami diyang noodles, maraming pho, maraming bun, BANH. So yun yung kanilang bread. So maraming banh mi and a lot of other carbs here, pero we always focus on meat, on real food. So real food would be in their most natural form. So safest would be egg and unprocessed meat, yung prito lang and or grill lang para mas madali yung ating pagkain and mas maganda yung ating healing. So yan, congratulations sa mga 5 months nang naka-low carb, and the rhinoplasty will depend on your surgeon, will depend on your anesthesia, will depend on your graft, kung kakailanganin ba kayo ng Gore-Tex, kakailangan ba kayo ng mesh. So, iba't iba yan. Ay, napaluto sila ng scramble, ng sunny side up eggs. Gusto ko rin sana. Pero wag na lang. Marami na tayong pagkain. So, yon. This is the post-op na result after 2 weeks. After 2 weeks. Would you like to see it? Later na lang, no? Ipapakita ko sana sa inyo kung gaano kamaga yung day 1, day 2, day 3. Sobrang maga talaga. Merong face on the first week na yung mukha ko parang Indian. So, that's why hindi muna ako nag-live kasi baka mabigla kayo at baka hindi nyo na ako makilala kung sino ito. At least now, it is still me, but something different. Pero alam nyo, ako pa rin to. 'Di ba? Oo, rhinoplasty for senior citizen. Meron kaming pasyente. Yung pinakamatanda naming pasyente, 79 and 81. And I'm so, so happy for her. Happy talaga ako sa kanya. Kasi yung iniisip niya, for the longest time, she always wanted. Kaya nga lang, inuna yung family, of course, at lahat-lahat. But eventually, she decided na she wants it. At kahit ako din, like, if not for earlier phase, like for example if I will think meron akong terminal illness and I know I'm gonna die soon, and I know I want to look, I would like to look happy with what I look, I think I would go for rhinoplasty. Just so mga last wishes ko sa buhay, to feel good about myself. And nobody else can dictate that. Nasa sa inyo yan. So, yes, as long as makiklear, meron namang cardiopulmonary clearance. Speaking of cardiopulmonary clearance, shout out to my Bilas ba yun? The sister-in-law of my sister, Dr. Chu, Dr. Ava Chu, for my CP clearance. Maraming salamat po. And to everyone who helped me along the way, especially my fellows in training. We have Dr. Neil and also Dr. Chen and others na hindi gusto magpakilala. So, yon, maraming salamat po. I'll be accepting surgery. I'll start my own facial plastic surgery practice starting 2023. This 2022 is dedicated for something else. So I have the whole year planned out, mostly for our community, for our low carb and fasting community, for our masterclass. Kasi patapos na tayo sa ating Filipino masterclass, yung ating masterclass in lifestyle diseases, diabetes, hypertension, fatty liver, gallbladder diseases. Marami ding more on sa ating mga other na mga illnesses. So, PCOS, cancer, for those with female health problems. So, those are the things na gusto nating i-share also with the rest of the world. That is why after the completion ng ating Filipino masterclass, I think matatapos siya by June or July. We will now start with the international masterclass kasi marami ring gusto to enroll because they've seen, especially yung mga husbands and wives, mga partners ng ating mga fellow Filipinos that are foreigners na gusto ring makaintindi. They want to understand as well. That's why we will make an English version, international version of the low carb and fasting masterclass. And shout out to our members, sa mga exclusive members ng ating masterclass, the 14-day masterclass and the 21-day masterclass. Maraming salamat po. You are the reason why we can continue to serve and do everything that we can do for all of you. So, yan. I'm so happy. Congratulations sa mga naging successful sa ating mga low carb and fasting advocates. At least right now, nakabalik na tayo sa ating fasting schedule, although not as usual as 18 to 20 hours, at least 16 hours. Okay na. Okay na ngayon. Kasi the other week talaga, when I first arrived here in Vietnam, wala, 12 hours lang siguro yung ating fasting nun because we were in night markets, and then merong mga free early birds, and also in the airports marami din. So those things. nahuli po ako sa live, nagtaka ako kasi same boses. Oh, yun yung sinasabi, no? Yung boses lang yung kilala, pero yung mukha ko nag-iba na. But actually, you get used to it easily. Yung sister ko, parang 5 seconds lang siyang na-shock sa itsura ko. After yan, sanay na siya sa tsura, sa bagong mukha ko. So, yan. So, aking aping. Ang cheeks in Bisaya is aping. Ang akong aping na dako. So, dako ug aping. So, that's cheeky. That's a very cheeky. And we should embrace that. We should embrace that na meron tayo niyan. At least as we age, we know we will still look a little younger than our real age. So that's okay. So that's our healing. Kapag walang gana, you can fast. Kapag kakain na, just stay low carb and you will see that you will heal easily. Hindi lang for healing for rhinoplasty, for facial surgery, even other injuries. Even injuries kapag meron kayong sugat or merong kahit anong pamamaga sa katawan, inflammation, or you underwent any surgery, okay? So you can actually just go and fast when you feel like you need to fast, and also you can continue to eat low carb, stay low carb. Hindi kailangan ng sugar for healing. Always remember that ang sugar ay optional lamang. Ang optional na yan can be given by our liver. Hindi tayo kailangan kumain ng sugar just so we can maintain a normal blood sugar. And so, kakain ako kasi baka magsarado na dito at ako na lang yung mag-isa. Although, buti na lang merong family na kararating lang. So, I won't feel like ako na lang yung hihintayin nila. And if you wish to visit Vietnam, Vietnam is really good. Really, really beautiful. Yes, Shopa ug Aping. Yes, that's the ano yan, since birth, since birth yun na yung tawag sa akin, Shopaw face. And it's okay. I will be practicing in Bacolod first, but I will be practicing in other places in the Philippines as well. So, thank you so much po. Medyo antok pa ng konti because I woke up a little early. So, maraming salamat everyone. Cheers! So, thank you. And remember to always stay low carb so that we all stay safe. Bye!